Welcome to the Slop Temple. We pray this video helps.
You start by confirming the exact Tanzo dose, concentration, and schedule. This prevents mistakes. Once done, wash hands thoroughly and set up on a clean, flat surface. You should gather the syringe, needle, alcohol swabs, and a sharps container. Make sure the vial is the correct medication, clear and within date. If cloudy or expired, do not use it. Draw room temperature medication next, avoiding bubbles, and keep your routine steady so you don't rush the injection. You wipe the vial rubber top with a 70% alcohol swab and let it air dry so contamination is minimized. Then pull back the syringe plunger to the prescribed volume, insert the needle, and inject air equal to the dose. This eases withdrawal. Withdraw the exact dose slowly, tap out air bubbles, and push any remaining air out. Accuracy matters. Once your measured dose is stable, recheck the patient identity and dosing instructions, because a quick verification prevents misadministration. You select the appropriate injection site, rotate sites if repeated dosing is required, and clean the skin with an alcohol swab. Once dry, position the needle at the recommended angle and insert with a quick, confident motion. Inject the medication steadily, then withdraw slowly and apply gentle pressure. Afterward, dispose of the needle in a sharps container immediately and monitor the patient for 15 to 30 minutes for any allergic or adverse reactions. If swelling, severe pain, or breathing trouble occurs, seek emergency care right away.
Thanks for watching. Consider subscribing if we helped you.